The recent guidelines suggest a turnaround in what we've been traditionally doing in pain management. The tried and true approaches from the past years of using opioids or other pharmacotherapies work less well in the current scientific evidence, and so really it's a matter of transitioning away from those passively received medical treatments to a more active self-management approach. That's really the gist of the current guidelines. And often that has been implemented in multidisciplinary teams in hospital-based pain management services, but the challenge for general practice is to how to implement that broader approach in a primary care context. There is a key aspect in terms of the management of medication, I think. GPs may, perhaps in past years, very much have been involved with prescribing opioids and other medications. So now the recommendation is around opioid deprescribing, that the GP may be supporting a patient to gradually wean that dose down with a view to coming off that, and then at the same time to help the patient transition, which can be an emotionally difficult phase, to a more self-management based approach. And that in itself will include some psychological aspects, ways in which the patient might more helpfully think, an emotional component to that as well, and also addressing other aspects like physical activity and nutrition. In a 6-hour ALM, we will have plenty of time to flesh out some of these ideas in more depth. So it really is about very practically giving GPs the skills to implement some of these ideas. We know from a fair amount of evidence that simply providing education in itself is not a good way to achieve behaviour change in general practice or for any of us doctors. So the 6-hour ALM gives an opportunity to perhaps undertake some role plays and get into some case discussion and work a little bit on practical implementation of all these theoretical ideas.